Hello. If you are watching this video, you probably have questions about Kratom. Maybe you are a healthcare professional. Maybe you use it. Maybe you are thinking about trying it. Or maybe someone close to you uses it. If that is you, you are not alone. Kratom use has grown in the United States and in other countries. At the same time, the exact number of people who use Kratom depends on the study and the population being measured, so the estimates can look very different. But one thing is clear: Kratom is no longer a small, rare topic. There is also something people do not talk about enough. Kratom can cause physical dependence, and when you stop, you may experience real and sometimes significant withdrawal symptoms. Today, we will focus on what science actually says about Kratom withdrawal. What happens in the body, what symptoms to expect, and what treatment paths often help. No confusing language, just clear, practical science. Let's begin. First, what is Kratom? Kratom comes from a tropical tree called Mitragona speciosa, native to Southeast Asia, including Thailand, Indonesia, and Malaysia. People have used it for a long time in some traditional settings. Today it is marketed in many ways, such as a natural energy supplement, a pain reliever, or a tool to help people stop opioids. Here is the key point. Kratom is not an inactive plant. It contains many chemical compounds called alkaloids. These compounds can cause real effects in the body. Two important alkaloids are mitragynine and 7-hydroxymitragynine. These alkaloids can interact with opioid receptors, especially the mu opioid receptor. That is one of the same receptor systems targeted by opioid drugs. Because of this, Kratom can produce effects such as pain relief, changes in mood, relaxation, and in some people, euphoria. One important detail: 7-hydroxymitragynine is usually described as having a stronger opioid effect than mitragynine. It may be present in some products, and it can also be formed in the body from mitragynine through metabolism. This means the effects of Kratom can vary depending on the product, the alkaloid content, and the person. So why does dependence happen? When Kratom is used regularly and repeatedly, especially multiple times per day for weeks or months, the nervous system gradually adapts. Systems involved in pain, reward, stress, and sleep adjust to the repeated exposure. This can lead to tolerance and physical dependence. When Kratom is stopped, the body and brain need time to readjust, and withdrawal symptoms can appear. A key finding from newer research is this: in many observational studies, the pattern of use, especially how many times per day someone doses, can predict withdrawal symptoms and Kratom use disorder symptoms more strongly than the total daily amount alone. In other words, two people with a similar total daily amount may have very different withdrawal experiences if one person uses Kratom more frequently during the day. Section 2. Kratom withdrawal symptoms. The full picture. When someone stops Kratom after regular use, the body can enter withdrawal. Before we go step by step, one very important note: the timing and intensity of withdrawal can vary a lot between people. So think of this timeline as a common pattern, not a fixed rule. Stage 1. Symptoms begin, often within the first 12 to 24 hours after stopping or sharply reducing. You may feel restlessness and anxiety, early muscle discomfort or muscle twitching, early strong urge to use Kratom, irritability, trouble falling asleep. Many people do not recognize this as withdrawal at first. They just feel off. For many people, psychological symptoms like restlessness and anxiety are noticed first. Stage 2. Acute phase. Often during days 1 through 3 with wide variation in severity. This is often the hardest period, but severity differs from person to person. Possible physical symptoms include muscle pain and muscle cramping, joint pain, gastrointestinal symptoms such as nausea, vomiting, diarrhea, and abdominal cramping, heavy sweating, hot flashes followed by chills. insomnia even when very tired, hand tremor, increased heart rate and increased blood pressure, runny nose and watery eyes, frequent yawning. Possible psychological symptoms include severe anxiety, sometimes feeling like panic, low mood or depression, irritability and emotional swings, strong urge to use kratom, trouble concentrating, and brain fog. A key point: scientific summaries often describe kratom withdrawal as milder than withdrawal from strong opioids on average. But that does not mean it is easy or unimportant. Many people describe it as very difficult. And the psychological part, especially anxiety, depressed mood, and strong craving, can be as hard as the physical symptoms. Stage 3. Gradual improvement. Often days 4 through 7, usually trending downward. Many people start improving, but may still have physical discomfort that is less intense, but still present. Gastrointestinal symptoms that slowly improve. Sleep that is still disrupted. Psychological symptoms that remain noticeable, such as anxiety and low mood. Craving that is lower than the peak, but still present. Low energy. Stage 4. Continued improvement. Second week around days 8 through 14. Often, physical symptoms are minimal by this point, but sleep may not be fully normal yet. Energy continues to improve. Anxiety, low motivation, or low mood may persist. Craving may flare during stress or when exposed to triggers. Stage 5. Longer-lasting symptoms in some people, weeks to longer periods. Some people report that after the acute phase ends, they still have periods of low mood, anxiety, low motivation, or craving for weeks or longer. An important scientific point: strong, systematic data on how common this is and how long it lasts for kratom specifically are limited. But clinically, these lingering symptoms can increase relapse risk, especially when someone expects to feel completely normal after 2 weeks and then feels discouraged when they do not. Why severity differs between people. What does science say about who has harder withdrawal? A large study in 2024 examined almost 400 regular kratom users and found that dosing frequency, meaning how many times per day someone uses, was more strongly linked to withdrawal symptoms and kratom use disorder symptoms than dose amount alone. Factors often linked to harder withdrawal include higher daily use. Some reports discuss levels such as more than about 40 grams per day. Multiple doses per day, especially more than 3 or 4 times daily. Long-term use, such as more than 1 year. Mental health conditions, such as depression or anxiety. Use of other substances at the same time, such as alcohol, benzodiazepines, opioids, or stimulants. In some datasets, men reported more symptoms, but the exact reason is not clear and may involve both biology and behavior. A very important safety note: kratom withdrawal by itself is usually not the classic life-threatening withdrawal seen with alcohol or benzodiazepines. However, it can still be severe in terms of suffering, dehydration, sleep disruption, and psychological distress. And if there is withdrawal from other substances at the same time, use of multiple substances, or serious medical illness, the situation can become much more dangerous. Many internet discussions miss this. The psychological side of kratom withdrawal can be very hard, and it is often the main driver of relapse. With regular use, brain systems related to mood, motivation, sleep, and stress response adapt. When kratom is stopped, those systems need time to regain balance. That is why anxiety, depressed mood, and low motivation can continue even after physical symptoms improve. Many people can endure muscle pain and nausea. What can feel harder is hopelessness, low energy, and strong craving. This is not a character flaw. It is a real biological and psychological process, and it often requires real support. Now, the most important part: what can actually help? First, one principle: Scientific evidence for kratom withdrawal treatment is still mostly based on observational studies, reviews, and clinical reports. Strong randomized controlled trials are limited, so there is no single plan that fits everyone. Treatment should be individualized based on daily amount, dosing frequency, duration of use, opioid use history, mental health, and use of other substances. A common starting point: supportive and symptom-based care. For many mild to moderate cases, supportive care can be enough. Fluids and electrolyte replacement when needed. Medicines for nausea and vomiting. Diarrhea control when needed. Non-opioid pain relief for muscle aches. Sleep support with lower risk options. Psychological support and a plan for craving management. Option 1. Buprenorphine, often combined with naloxone under medical supervision. Buprenorphine combined with naloxone has the most published clinical experience for moderate to severe kratom use disorder, and in some people, it can significantly reduce withdrawal symptoms and craving. However, an important scientific caution: expert summaries emphasize that buprenorphine and methadone should not automatically be first choice for everyone, especially for people without opioid use history, because buprenorphine is an opioid medication and can itself cause physical dependence if used inappropriately. This decision should be made carefully by a clinician experienced in addiction treatment. How buprenorphine works. It is a partial opioid receptor agonist. It binds strongly to opioid receptors. It can reduce withdrawal symptoms and reduce craving. It has a ceiling effect, which can make it safer than full opioid agonists in many scenarios, but it is still a serious medication. Dose frameworks. Some limited clinical reports suggest a relationship between kratom daily amount and the buprenorphine dose needed. A rough framework suggested in a small clinical literature base, not an official guideline, has included less than 20 grams per day, about 4 to 8 milligrams per day, 20 to 40 grams per day, about 8 to 12 milligrams per day, more than 40 grams per day, about 12 to 16 milligrams per day, and sometimes more. These numbers come from limited report-based data and do not replace medical evaluation. When treatment is started, rather than starting at a fixed number of hours, a more accurate approach is this. Buprenorphine is usually considered when withdrawal symptoms have reached a moderate level to reduce the chance of sudden worsening of symptoms. A clinician typically starts with an initial dose and adjusts based on response over the next days. How long treatment lasts. Clinical reports include people staying on maintenance treatment for months to more than a year. The right duration depends on severity, relapse risk, opioid use history, chronic pain, and mental health. The goal is not to swap one addiction for another. The goal is medical stabilization so the brain can recover and the person can work on the underlying drivers of use. Who may benefit more? Moderate to severe kratom use disorder, long-term use with frequent daily dosing, repeated failed attempts to stop and repeated relapse, coexisting chronic pain or mental health conditions that worsen craving. Situations where controlling craving is critical to prevent relapse. Option 2. Clonidine or similar medicines plus supportive care. Clonidine reduces sympathetic nervous system activity and can help symptoms such as sweating, tremor, rapid heart rate, and high blood pressure. Some protocols use doses such as 0.1 to 0.2 milligrams every 6 to 8 hours for a few days, but only under medical supervision, because clonidine can lower blood pressure too much and cause dizziness, weakness, or fainting. Clonidine is often combined with medicines for nausea, lower-risk sleep support, non-opioid pain relief, psychological support for anxiety and craving. Key point: clonidine may make the acute phase more tolerable, but it does not directly treat craving in the way opioid agonist treatment can. That is why relapse prevention planning and behavioral support matter. Option 3. Gradually reducing use instead of stopping suddenly. Gradually reducing the amount you take can lower withdrawal intensity by giving the body time to adapt. General principles. Measure your baseline use carefully. Reduce by about 10 to 25% every 3 to 7 days for a slower, more tolerable approach. If symptoms become severe, pause at the current level until stable, then continue. A very important scientific detail. Kratom products are not standardized for alkaloid content. Even if you reduce grams precisely, the real pharmacologic effect of each dose may not be consistent. So dose reduction should be flexible and symptom-guided. This approach may fit better for shorter duration of use, lower daily use, strong social support and stable living conditions, access to counseling and follow-up. Option 4. Behavioral and psychological treatment. No matter which medical path is chosen, behavioral and psychological support is a core part of long-term success. Cognitive behavioral therapy to identify triggers and build healthier coping strategies. Motivational interviewing to strengthen motivation and reduce ambivalence. Individual counseling for root causes such as chronic pain, anxiety, depression, or opioid history. Group therapy and peer support for accountability and community. Best outcomes are often seen when medical treatment, when appropriate, is combined with behavioral support. Section 5. Special situations. A few situations change the approach. If you have chronic pain, many people use Kratom for chronic pain. If Kratom is stopped but pain is not treated, relapse risk rises. A treatment plan should include pain management. If you have depression or anxiety, withdrawal can worsen symptoms or reveal symptoms that were already present. Mental health support and appropriate treatment may be needed. If you are pregnant, stopping suddenly without medical supervision is not recommended. Decisions should be made by a specialized medical team. If you started Kratom to stop opioids, this can be more complex and usually requires a clinician experienced in addiction treatment. If gradual reduction fails or relapse keeps happening, that is not a weakness. It often means you need more professional support and sometimes medication support. If you are dealing with Kratom withdrawal right now, here are practical steps. 1. Talk to a clinician or therapist and be honest about daily amount, dosing frequency, and duration of use. 2. Get an assessment to estimate the severity of dependence and the best treatment path. 3. If medication treatment is recommended, work with a clinician who has experience treating substance use disorders. 4. Combine medical care with behavioral support whenever possible. 5. If your use has been heavy or you use other substances, do not underestimate the risk of stopping suddenly without support. This video is educational. If your withdrawal is severe, if you have thoughts of self-harm, or if you cannot function day-to-day, seek urgent help. In the United States, the Substance Abuse and Mental Health Services Administration has a free, confidential, 24-hour national helpline, 1-800-662-4357. We will also put this number in the video description. Here is what I want you to remember. If you are dealing with Kratom dependence or withdrawal, this is a real medical and psychological process. It is not a moral failure. It is not a lack of willpower. It is biology and nervous system adaptation. The good news is that Kratom withdrawal can be managed and treated. For some people, supportive care is enough. For others, medication treatment may be needed. And for almost everyone, behavioral and psychological support is a key part of long-term success. You do not have to do this alone. Getting help is not a weakness. Thank you for watching Medical Toxicology. Please take care of yourself.